And welcome to the Dr. Bob Show. Most men worry about prostate disease, and they should, because prostate cancer is one of the most common cancers in men to cause cancer-related death. How is the diagnosis made? What are the symptoms of prostate cancer? What treatment is available? We'll be spending most of this show talking about prostate cancer. My guest is Dr. Chris Ramsey. Dr. Ramsey is a board-certified urologist, and we're going to be spending most of the show talking about a da Vinci robotic surgery. I am so excited to learn about how this works. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about sinus infections. Do they really need to be treated with antibiotics? And your immune system. Is it working properly? Can it be evaluated easily by doctors? And what's needed to evaluate your immune system so you'll know that it's working properly? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Chris Ramsey, board-certified urologist who does da Vinci surgery, and we're going to be talking about prostate problems. Chris, welcome to the Dr. Bob Show.
Thank you for having me.
Tell me about the prostate gland. Where is it located, and what kind of problems does it cause in general?
Well, the prostate gland is located in the pelvis, and it's between the bladder and the urethra. And as far as what it does, its function is to activate sperm so that you can have babies and become fertile.
So it's, in a way, it's a reproductive assisting organ?
It's the male sex organ.
Yeah.
That's right.
So things that can go wrong with it. Tell me about prostate cancer. How common is that?
Prostate cancer is the most common cancer in men, not skin cancers. But it is the most common cancer in men. About 1 in 6 men will get prostate cancer in their lifetime.
So it's very, very serious. When do men need to start worrying about or looking at or getting examined or trying to find out if they're that person that has prostate cancer? What age do we start?
Well, men who have a family history of prostate cancer need to start earlier. So typically about 40 years old, a man needs to get a PSA, which is a blood test.
Now what does PSA mean?
That is a blood test that looks at prostate-specific antigen. And it is a blood test that's specifically made by the prostate. And it can be elevated in other conditions that are benign, including prostatitis, which is inflammation of the prostate, or enlarged prostate can increase the PSA.
So if you get an elevated PSA, it causes some concern. How do you know if the person has prostate cancer if their PSA is elevated? Well,
the first thing you have to do is do a biopsy if the PSA is significantly elevated. And a biopsy is something that we typically will do in the office. Sometimes there's some sedation that's required, but not all the time. And it's a probe, an ultrasound probe is inserted into the rectum so that we can see where the prostate is. And then we typically numb the prostate up so that you don't feel the needles as they go into the prostate for the biopsy. And it typically takes about 5 minutes and very well tolerated. There are some risks that go along with it, so we have to make sure we don't get an infection.
I think there's risk with everything. Are the risks very high when you do a prostate biopsy?
About 1 to 2% chance of getting a serious infection. We usually will treat that with an antibiotic before and after the biopsy, and that usually will take care of that.
Now, back to before and about the time we get the PSA, how about digital rectal exam? A rectal exam, nobody wants that.
Right.
How important is that? Can we just get by without that?
I wish we could, but about 20 or 25% of prostate cancers can be found with an abnormal digital rectal exam and a normal PSA blood test.
And a normal PSA.
Right.
So the PSA is not necessarily the first thing that gets out into the system.
That's right.
I know a physician in Knoxville. That was the exact case, and he was a young person, and the digital rectal exam showed a prostate cancer, and he went on, was treated, and he's still a very successful person. So what does it feel like if you're doing a digital rectal exam? What does the prostate feel like?
The prostate feels typically like your thumb muscle. if it's a normal prostate. It's very smooth. A prostate that might have cancer in it will have a hard lump or a firmness to it.
Is it rocky, gritty, big, little, size of the end of a pencil lead, or as big as a cauliflower?
It can be a pea size. It can be larger than that. Sometimes it can be very small.
Easy to feel?
It's fairly easy to feel once you've done enough of them.
Sure. And the prostate gland in general feels soft and smooth?
Right.
If it's enlarged, if you've got benign prostate hypertrophy, you've got an enlarged prostate.
That's right.
What does that feel like?
It feels larger, like a larger soft muscle.
If it's larger like that, is it maybe more difficult to feel a hidden prostate cancer?
It certainly can be if the prostate cancer is deep in the prostate. And you actually don't want to feel the prostate cancer. If you feel a bump, then that means that it might be a little more aggressive or a little more advanced than we would hope for. So we don't usually feel prostate cancer.
What age would you recommend that I started getting? There's no prostate cancer in my history in my family. What age would you recommend that I started?
The new recommendations suggest that we start at 55. We used to start at 50, so between 50 and 55 and up to the age of 70, and if you have very good health, we might want to go longer than 70 to check for prostate cancer.
To me, 55 is, I'd sort of want to get started at 45 or 50 if I was advising somebody. So why do they wait till 55? Because that's when you get the best results.
Well, no, there's a lot of controversy with PSA, and we might find a lot of prostate cancers that are early and indolent, meaning that they're not going to cause any problems at all. And a lot of prostate cancer won't cause problems in a man's lifetime. So we might be over-diagnosing prostate cancer by checking younger men. So if you have a family history, if you're a black male, you probably should be getting checked at age 40. Most people are going to get checked at 50. Again, the new recommendations suggest 55. Again, controversy with that, and I agree with you. I think I'd want to get checked. I've been getting checked since I was 40.
So should you always get both? When you get started, when you get a PSA, you should get a digital rectal exam called DRE.
Right.
I like those mnemonics like that type situation, and that can pretty much tell the doctor if he needs to investigate further. Now,
Right.
if there is benign, the prostate is enlarged, and the PSA is up, that could be just due to the enlarged prostate. Doesn't mean there'd be cancer.
That's right. It doesn't mean there's going to be a cancer, but there could be a cancer. And so if the PSA is elevated, then we may want to go ahead and do a biopsy, and just to make sure we're not missing something. And then after that, we can follow that PSA. If it continues to rise, we may need to do another biopsy at some point. But if it stays fairly stable, even though it's elevated, we may not be as concerned.
Might there be harm if somebody had an elevated PSA and their prostate was enlarged to say, well, let's get another one in 4 months and see if it's getting higher and higher, or it's better to get to work right away? If you find it, get to work, don't mess around.
It depends on how high the PSA may be and what it had been in the past. So if this is your first one and it's significantly elevated, you may want to check it again in about 3 months to see if it continues to rise. If you've had a very low PSA for a long time, then all of a sudden it jumps up, then you may be more likely to do the biopsy.
So what's a good PSA? Somebody that has their PSA and the doctor says your PSA is, what level is good, normal?
Well, so there can be a range for age is something that we look at quite often. So between the ages of 40 and 50, we like to see the PSA less than 2.5.
Less than 2.5.
Between 50 and 60, less than 3.5. 60 and 70, less than 4.5. And sometimes we'll accept even 6.5 over 70.
So that's pretty high. I would be pretty worried if my PSA was over 4.
Right.
That used to be,
That used
back
to be the
in the
number.
dark
Right.
ages, sort of the cutoff zone there.
Sometimes 4 is a too high of a cutoff. Sometimes with a PSA lower than 4, especially with younger men, we get concerned with that.
What if at age 50 you had a PSA that was 1 and it was really great?
Right.
And the next year it was 1.8. Would that make you nervous?
That'd make me a little nervous. I'd want to recheck it. I probably wouldn't do a biopsy immediately, but maybe check it in 3 months. If it went up to 2.5 then, probably
Bingo.
do a biopsy.
And the chances are you would be having problems if it goes up that fast.
There's more of a risk, that's right.
Is that
That's
correct? Prostate cancer, if it gets active and spreads, where does it spread?
Typically it will go to the bone if it goes anywhere first.
And by the time it's spread, there's real problem there. So you want to catch it before.
We do want to catch it early.
Are there a lot of people walking around that have had prostate cancer, that have had surgery and are doing well?
There's a lot of people. We diagnose 180,000 prostate cancers in a year, and maybe 30,000 will die in a year.
So there's 150 that adds on every year that way. The treatment of prostate cancer. There are several things that people can do, including just watching, or I'm interested in your teaching me about the Da Vinci robotic surgery. Is that difficult?
It is difficult. It's difficult to learn.
And that's what we're going to be talking about when we come back. It is difficult. It's difficult to learn. So let's see what the training is, what you have to do, how difficult it is, and what kind of results we get. It's fascinating. You'll want to stay tuned. We're talking with Dr. Chris Ramsey, board-certified urologist. We've been talking about prostate cancer. Really, when you get down to it, it's sort of really simple. If you take care of yourself, you've got to pay attention. You've got to have prostate examinations starting at age 40 or 50 or 55. Talk it over with your doctor. Digital rectal exam. It's got to be part of your exam, and you've got to have a PSA. Those figures will lead to how frequently you need to have that done. Chris, I want to talk about surgery. Can you just watch prostate cancer? Is that one of the treatments?
That's definitely one of the treatments.
Isn't that scary for a person?
And a lot of times it is scary, and so sometimes we're forced to do something because psychologically the patient doesn't want to just watch it. Though sometimes if they're older, have other medical problems, and just a small amount of cancer, it's very unlikely to affect them.
So if I'm 75 and I'm in good health, I don't know how long I'm going to live. My PSA goes up and you feel something a little dangerous and you get a biopsy. Could you recommend, Bob, it's very small, let's just see what happens over the next year?
That's one of the recommendations. That
Okay.
could be, absolutely.
If I said, I've got a cancer that's there, I want it taken off. Tell me about Da Vinci robotic surgery. How did it start? Give me some background.
So the Da Vinci robot was FDA approved in 2000, but before that the Department of Defense wanted to try to use it as battlefield technology so that a surgeon in Germany could operate on a soldier who's in Afghanistan, and that really hasn't come to fruition yet, but we found out that we could use it as an assistant to laparoscopic procedure, which is smaller incisions instead of the large incision in the belly to remove the prostate. Now we have 5 small incisions in the belly, fill the belly up so that you can see on the inside, and then remove the prostate just like you would with an open surgery.
What does open surgery mean, open?
Where you make an incision in the abdomen from the belly button down to the pubic bone.
You're there in the operating room, you make a big incision, you go in, you find the prostate, you take care of it, take it out.
Right.
Now, let's talk about robotic. Are you in the examining room with the robot, or are you outside pushing buttons and doing this and that?
I'm about 10 feet away from the patient, so I am not right against the patient. And the robot is hooked up to the patient through small tubes, and the robot has very small hands. It allows you to do very small, fine, delicate, detailed maneuvers that your big hands can't do. 10 times magnification and 3-dimensional vision. So it's really like you're a little man running around in the abdomen. Just amazing technology, and it's really changed the way that we do surgery.
What's it like to be 6 feet away and be in the abdomen? It just must be the most exciting thing.
It's comfortable because instead of standing for 2 hours, you're sitting down, and the better you get, the quicker you become. But it's more ergonomically comfortable. You're sitting down for a surgery, which is helpful.
Now, what is your magnification? You were talking about that, and I didn't get that.
10 times magnification, so your visualization is enhanced more than what your normal eyes can see.
So it makes it easier. We just don't have to look down there with your glasses or with your eyes. You can sit there with magnet. So where does that help you? Does it help you identify the nerves, the surrounding vessels, the prostate gland? How does it help you?
It helps identify all those things you talked about. So there's less bleeding because you're able to control the blood vessels more specifically. There's less pain because there's smaller incisions and quicker recovery. So the robot, I think, the only thing that you can't do with the robot is actually feel the prostate. You can see it, you know what's going on. You sometimes can get a mental feeling of feeling the prostate.
Sure.
But that's the only kind of disadvantage that you have with the robot.
How big a bite, which is the only way I know how to consider, do you take at a time? Do you cut out the whole prostate? Do you take out a slice of it? Or what do you do in the surgery?
You remove the entire prostate.
So How do you do that? It's got a capsule?
Well, so the prostate is attached to the bladder, and you actually have to cut through the bladder, all the way through the bladder, and then have to peel it off of the rectum, which is right below the prostate, and then come through the urethra, which is in front of the prostate. And then you put the prostate into a bag, and we pull it out of the belly button at the end of the procedure. And the amazing thing about the robot is then you have to sew the bladder back up to the urethra. And with the robot, on the size of something the size of my pinky, you can put in 15 or 16 sutures to really get that bladder and that urethra nice and watertight so that urine doesn't leak.
You're a tall guy. You've got big hands. If you're doing the surgery open, as you say, you have to really get things out of the way of the robot. It sounds like it's so much simpler, is it?
With the open surgery, only one person really sees what's going on. With the robot surgery, the entire operating room can see what's going on, and actually you can get some feedback from the people in the operating room to help you out.
And how much time does it take to do a normal prostate cancer robotic surgery?
It's different for your experience. The first one I did took me 8 hours, and now it takes me about 1 hour and 15 minutes to do the surgery.
So in general, it's 1 hour to 2 hours or 3 hours somewhere.
2 to 3 hours is pretty average.
How much training does it take? Do you have to train for 25 years or 25 cases? How is the training done on this?
Well, the robot came after I finished my training, so I had to go back and learn. And so I had to take several courses. I had to go and operate on a cadaver, and then I had to do a couple of live cases with the help of another physician who had done several of these surgeries. And then I was on my own, and so I had to learn on my own. Now there's a lot of robots. People are being trained in residency so that when they come out of residency, they already know how to do it, and they're ready to go.
Now, Chris, I'm going to want to do a field report with you where you and I can go and you can let me touch one of the robots.
I'll let you operate it.
Just so I don't operate on a person. But we'll look at that and you can show me on one-on-one how the robot works. Would you be able to do that with me?
That'll be fun.
You're a great guest. Thank you for coming and teaching the Dr. Bob Show, and I can't wait to touch that robot.
Thanks for having me.
Isn't that great? So let's look at the robot. Let's see what the robot can do. And then I'll close giving you some information on the immune system and treatment of sinusitis. You'll want to stay tuned. Whoa, this is a new experience for me. We're at Physicians Regional, and I'm with Dr. Chris Ramsey. We're in the Robotic Center, and Chris, you're going to show me exactly what to do. So walk me around and tell me where we are.
Okay, this is the OR room, and this is the patient table. This is where the patient would lie during surgery. The first part of the robot, which is probably the most important part of the robot, is the patient cart. And this is actually what is translating my movements from the physician console over to operating on the patient.
So you're not standing over here, you're over at the console that we'll go to in a minute. And this is the surgical arms right here?
That's exactly right. These are all the surgical arms. There's a camera that the physician controls. You have 3 separate arms that you can control and switch back and forth between the arms in order to sew, in order to dissect tissue. So this is where the actual operation occurs.
What kind of surgery can be done with this robot?
Almost any type of surgery that can be done laparoscopically can be done with a robot, or any type of surgery laparoscopically.
So you do prostate surgery,
yes,
you can take out the prostate, you can operate on the colon, on the bladder, all those things.
Well, the kidneys, you can actually do tonsillectomies.
So it's more than just in the abdomen. Do they do any chest work?
Cardiothoracic surgeons do mitral valves. They also do some bypass surgeries, lungs.
So let's go over to, what do you call the other machine?
That's the physician's console.
The physician's console. Let's walk over there. Show me what it's like. This is the physician console.
Correct. Have a seat.
So I'm going to be the surgeon right here.
Right.
I've got a little handpiece right here that I put my fingers in. And now when I look in.
So this is the monitor. What you're looking in, it's binocular vision. So you have 3-dimensional vision. Your hands control the instruments.
And the feet.
And the feet control which instrument you're using. It controls the energy that you use in order to do surgery. And it also controls the camera. So you really have complete control of the entire operation from from the physician console.
So the magnification here is about tenfold. It just brings it right up to me. A minute ago, you showed me how to do a suture. It brought me back to my medical school days. So I did a suture. It was amazing how quick you could teach me how to do this. The advantages of using the robot would be
less bleeding, quicker recovery, smaller incisions, so less pain.
Wow. So does the robotic surgery for prostate surgery, does it help you have less incontinence or less erectile dysfunction?
I think that the robot surgery probably helps with erectile dysfunction resolving sooner. I don't think it necessarily in the long run is better for erectile dysfunction or even incontinence, but I think you do have a quicker recovery with the robot surgery.
I was talking to a patient the other day who you did his prostate surgery, and he said, zingo, no problems that he had afterwards. Is that a typical?
That's, for the most part, that is a typical patient.
I think that's fabulous. Chris, this is more fun than I've had in a month of Sundays.
Well, thanks for coming.
Thank you so much for teaching me, and thank you for being part of the Dr. Bob Show.
My pleasure.
It's been great. I want to thank Dr. Chris Ramsey. Wonderful discussion on prostate cancer and the use of the Da Vinci robotic surgery. And now questions from you, the viewer, that I think will be important to your health. Dr. Bob, I get recurrent sinus infections. What should I do? Well, let's talk about sinus infections. The most common cause of sinus infection is a viral infection. Usually it's what we call self-limited. That means it's going to go away without antibiotic treatment. We get a runny nose, then we get pressure around the sinuses, and over a 5 to 7 day period, it will usually go away. Now, if the sinus infection persists and you start blowing out yellow or green, or you get a low-grade fever and you start getting pressure, that's the sign that bacteria may be taking over inside the sinuses, and you have to see your doctor. At that time, he will examine you. He may get a CT scan of the sinus. That will show how much infection is there, and then proper treatment can be performed. The sinuses are holes in the head that drain into the nose. There are 2 cheek sinuses, there are little ethmoid sinuses, forehead, frontal sinuses, and in the middle head, sphenoid sinuses. They all drain into one area. So why do people get recurrent sinus infections? It could be their immune system is not working good. We'll talk about that in a minute. It could be that the drainage areas are narrowed. It could be underlying allergy, underlying polyps, underlying anatomy problems. So if you're getting recurrent sinus infections, you really do need to have that evaluated. Now, question number 2 fits right in here. Dr. Bob, is it possible to check out my immune system? Well, if somebody's having recurrent sinus infections or recurrent infections, or they're worried about their immune system, we can evaluate the immune system. Let's talk about how. Number 1, we get a routine blood count. The routine blood count can tell us how the different cells in the body are working, and that is a great start. Then we measure what we call immunoglobulins. They're the antibodies. They're antibodies that neutralize bacteria and help us fight off infection. If the immunoglobulins are low, one of them, the IgG, the neutralizing antibody, can be replaced. If it's IgA, it gives us an understanding of why we're getting underlying recurrent infections. Now, if the immunoglobulins are normal, then we have to measure the body's ability to produce antibodies. And so we can measure pneumococcal antibodies. You and I get a pneumonia shot, that produces pneumococcal antibodies. We can measure that. We can measure the baseline if you've never had a pneumovax, then give a pneumovax shot and then measure what the response is to that. We can do the same thing with tetanus. One of the things we can do, most people have had a tetanus shot, we can measure tetanus antibodies. That will give us a good idea if the body is responding. So now we've measured antibodies, immunoglobulins. We've measured the ability to respond to those. If we need to go further, there are cells we call B cells and T cells, medical stuff. But we can evaluate those, see how many there are, and how functional they are. So yes, we can measure your immune system. It's really pretty easy in your doctor's office. Yes, if you're having recurrent sinus infections, it could be that your immune system is not working well. Well, that's all the time that we have for this show. I hope you've enjoyed it as much as I have. Remember those 4 things that we want to do. Exercise, most important thing you can do, because exercise essentially takes care of everything. It helps us lose weight, helps reduce stress, it'll help lower our blood pressure, and we'll feel better in general. Eat properly and start that day off with a good breakfast. Too often we skip breakfast. Make the breakfast fruit and fiber, and then a small lunch, and then a smaller supper. If you get hungry in between, take a small snack, a quarter of a sandwich, a banana, some fruit. All those are excellent. The kind of food that we eat will keep our body size proper. 8 hours of sleep. Remember, most important thing one of the most important things you can do is go to work rested. We need 7.5 hours sleep as adults. As children, they need more sleep. There's 100 sleeping disorders. People need to know how to sleep. They need to prepare themselves for sleep. If you're having trouble, talk that over with your doctor. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. I hope you're laughing a lot, because the more you laugh, the healthier you're going to be.